Assalamualaikum and good day, madam. In today's video, I want to explain about my assignment one, which was the topic was about the disorders of childhood. And for the introduction, I want to explain that understanding that childhood disorder was very important because in every family, specifically if they have children, of course, they need to understand the childhood development from the earlyhood. And by understanding the problem, by not really the problem, but the issue that these children have, like ADHD or autism or something, it would be very useful for the parents because the disorder may continue into teenage years, and even adulthood. And if the issues or the disorder doesn't note yet until the child become older, it could be a problem for the children and also the parents itself. So it's better for the parents to know from the early time about the mental health about their children. And for the next one was the first disabilities in the childhood disorders. It could be the intellectual disabilities. That in these intellectual disabilities, the children with intellectual disabilities exhibit indicators of learning and development at slower than the children's around them. That the children may experience difficulty in learning in the school, learning the subjects in the school. They was hard to pay attention to the teacher, to the subject they was learning. And by knowing these disorders in early time, specifically in childhood time, it would be really helps for the parents because since they know the disorders from the children was small, they can find out, they can learn, they can try to find out how is the best way for the child to learn, and it won't be a big problem in the future. And for the second disorder was the autism spectrum. um, Autism spectrum disorder was a developmental disorder that changes how a person communicates through, interacts with other people, and how they act. Children with ASD or autism spectrum disorders could have problem reading social cues, showing how they feels, or making a new friends. And also they might do the same things over and over, um, or be very interested on certain things, and that would call like a spectrum to suggest the different people that have the different symptoms. And children with ASD, as I told before, they was hard to find, making friends, and also they keep doing the same things over and over again because it would be something wrong with them, as also the disorders. And it was very important to know from an early age because because the things was first, it could be very obvious for the parents to see, because the kids was not acting as normal kids, we would say. So if the parents has realized it from early age, the parents can go to the psycholog to talk about things so parents can understand more about the children's, because some of the autistic kids, they also like hard to communicate with their parents too, because their parents don't understand. So because the parents don't understand and the parents also don't know it was the autistic disorders, people might think that the child just rebelling to the parents, but it was actually autistic. So it could be very hard for the parents too. For the next one was ADHD. Children with ADHD often find it hard to pay attention in class. finishing touch, or sit quietly for long periods. It's not because they're lazy, or because they're not disciplined. It was something. It would rather say that something's different in their brain function, and especially in the areas that control the attention or the self-control. We could hardly say that this child was hard to control themselves. That's one of the reason why the ADHD come from. Also, the children with the imitation might have trouble staying focused because, as I said before, too, that brain, the area in their brain who was supposed to be allowing the child to able to self control, the area was distracted to other things, so the child wasn't able to self control themselves. So those with these disorders might very active, hyperactive, moving a lot, and talk too much, or have difficulty sitting still. Impulsive behavior can make them act without thinking, interrupt others, or take risks without realizing the consequences. So, because they don't have the self control they're supposed to have, they might create the situation they don't want to create also. Because of the ADHD, because of the disorder, they cannot control themselves, they cannot sit still, they cannot focus on things. It's not because they're lazy, it's because their brain telling them that we cannot do this, we need to move, we need to move. For the second one, there was specific learning disorders. Specific learning disorders is a condition that affects child's ability to learn and use certain academic skills like reading, writing, or math. Children with the specific learning disorders may have trouble understanding written word, spelling correctly, or solving simple math problem. They might re- they might read really slowly, skip word, or find it hard to remember where they just read. And in writing, they might struggle with the grammar or organizing the thought into a sentence. Because in this specific learning, the child wasn't able to remember correctly where the which one should I was, which word should I read first. Like the child confused, and it's make that's the one who make the children don't understand which words should they do, how to do the math work, how to read, how to write. And for the next one was the communication disorders. For the communication disorders was the symptoms of communication depends on the specific type. Children with language disorder might have limited vocabulary or trouble forming sentence. With those with speech sound disorder might mispronounce words or have unclear speech. And also, children with this disorder may have normal intelligence but struggle to express themselves clearly or understand what others are saying. These challenges can make the social interaction more difficult because they cannot understand the words that people talk to them, then they also don't know how to say. It could make the child struggle to understand what should they say and what are people talking to them. And the most children can improve them, and also from the earlyhood, the parents need to communicate with the child clearly step by step so the child can communicate, improve their communication skills step by step too. But still, parents cannot push the child too much because it could make the child feel troublesome or make the child feel pressure. Next one was the next one was the motor disorder. The many appears clumsy or have trouble with balance or finding it hard to perform movement that other children their age do easily. In motor disorder usually happens when some certain age when the child was usually already able to walk or run, but the child who was supposed to already able to do that they were still wasn't able to do it. Like it's like lately improved, they still crawling, or when the other child was already able to speak, the this specific child with motor disorder hasn't able to do it yet, and they might drop objects, struggle with sport, or have repetitive movement like hand clapping or blinking because their motor disorder was like distracting them to do other things like that. That disorder makes the child wasn't able to do the other things that the child was supposed to able to do. In school, these difficulties can cause frustration or low self confidence because they may take longer to complete tasks that improve physical coordination. Specifically, if the child was already in kindergarten or something, when other child was already able to run and already able to do some specific sport, but this specific child with this motor disorder wasn't able to do it yet. And for motor disorder are the type of developmental disorders that begin during childhood. As I also thought too that the muscles wasn't able to control the control themselves, and the movement wasn't very clear, so the child wasn't able to grab things very strongly, like their muscle wasn't that strong yet, so that could be very hard for the children to have their play date or things, so because the children wasn't able to enjoy the game they're doing. And for the overview, that in Malaysia, research shows that numbers in Malaysian children with development and behavioral disorders is increasing. For example, the Ministry of Health MOH reported that autism case rose sharply in recent years. In 2010, there was about 1,300 cases of autism reported in Malaysia. But by 2018, this number has increased more than 9,000. And even though awareness is growing in Malaysia, many children in Malaysia are still diagnosed late. Parents may not recognize this early sign of disorders, or they might feel unsure about seeking help because some people in Malaysia might think it's like there's no such a thing as a mental disorder. There's no such a thing as autism. There's no such a thing as a motor disorder or something. They just think that the child was normal, developing lowly. Like they might think it's just okay if this child is on the age of 5 years old hasn't able to walk yet. They might think, oh, it's okay, is this the child is still growing, but actually that could be a sign of a bad things. And this delay reduced the chance of early interventions, which is very important for improving the child's long-term development. For example, early therapy for autism can help children learn communication and social skills more effectively if the parents already know something wrong with their children, if the parents already understand what is the disorder that my child's having, the parent can seek for help. The parents can look for professional to help them, and service for children with disorders are available, but they are not always equal. In big cities like Kuala Lumpur, Penang, families can ac- access hospitals, special educational center, and private therapy clinic. But families in rural areas often struggle because such a service is limited or unavailable. That's also one of the minus part about cities and rural area, but time by time parents also already know social media and things. They might already see the sign, but they can try to improve themselves by it too. They can try to find help. But the family, maybe they might want to Google for things, help the children by themselves, even though there's no professional, but parents will try to do the best for the child. And for the conclusion was that the children with intellectual disabilities have difficulty with thinking, learning, and doing everyday tasks. Early diagnosis and support from families, teachers, and therapists can help to improve their skills and life more independently. In this nowadays, in the 21st centuries, there's still parents that don't believe in mental disorders. There's still parents who doesn't know what mental disorders is. Maybe some parents just don't care about that. But in this situation, we need to seek for help, especially for the babies, for the child, for the toddlers. If the parents already see some sign of a couple of specific disorders, parents should seek for help, specifically for like autism or motor disorder. Even though the even though it sounds really silly or things, parents still need to seek for help, even though it just small things like learning disorder, speaking disorder, communication disorder is still important because it can delay the speech delay for the kids. It would be hard for the kids to enjoy their childhood. That's all from me. That's all from me, Kalsum. Thank you very much. Thank you, Doctor.